Donc on va démarrer cette session avec deux présentations et c'est Dr Mofer qui va les modérer.
Bonjour tout le monde, j'espère que vous allez bien. Donc aujourd'hui, on a l'honneur d'avoir avec nous Dr Alsawy Marwan qui nous vient d'Égypte, particulièrement du Caire. C'est un dermatologue qui a beaucoup d'expérience, humble, expérimenté. Donc il est conférencier dermatologue et aussi il est coordinateur au niveau de l'unité laser à l'université Mestre des sciences et des techniques. Donc il va partager avec nous sa grande expérience en termes de laser CO2 H1 et on aura affaire à deux sujets. Le premier sujet sera porté, première des choses, sur l'optimisation thérapeutique des cicatrices d'acné par le laser CO2 fractionné. Et puis, en deuxième lieu, on va parler de la réjuvénation cutanée par laser fractionné. Marhaba bik, Dr. Alsawy. Bienvenue. Welcome to Morocco. Donc, you have 20 minutes for your first presentation, also for the second one, and the floor is yours.
Bonjour. This is the only French word I know. I didn't get any of the introduction, but I'm happy to be with you here. I would thank Monsieur Amin for invitation. So today we're going to talk about this marvelous technology I really love, fractional CO2 laser. So first of all, we will go briefly through the fundamental of laser that you all know. This is where we are. We are the 10,600 wavelength to target our chromophore water to make vaporization, so we will reach the ablation by fractional laser. So here is our heroes for today. We are going to rejuvenate using the three handpiece. One of them has already three handpieces. We will know today how to get benefit of each of these spacers and the surgical one. So here we are going to rejuvenate. And here we are also going to rejuvenate, but in a different way we are going to discuss. So here is briefly the idea of fractional laser, where your beam will be delivered into microthermal zones. In between you will have a healthy skin, which will cause your skin to heal with minimal downtime rather than the ordinary ablative surgical handpiece. So this is the normal beam and this is the fractionated one. So here the idea, first of all, we are going to discuss how these microthermal zones will be delivered to your skin. There's a multiple modes where you can spray your microthermal zones. We need to discuss first what the benefit, how can we utilize each one of them to reach the maximum outcome and how it will deliver more safety to our patients. So here, the standard mode, the old mode we are all using before. And recently, I've been using the random and the scatter mode much more because the idea in the random mode, it can deliver the heat randomly, so it will give more time for the area next to the microthermal zone to be relaxed a little bit until the another microthermal zone be delivered next to it. So it will deliver a beam here, 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 and go back again. So for little downtime, for safety, if you have a darker skin color, I will also recommend to go with this random mode. The scatter mode is a similar one, but the microthermal zones doesn't deliver it at a systematic square, we all know. So how we can get benefit of this mode? We all know that when we are making a fractional treatment for acne scar, for even full face rejuvenation, we have these demarcation lines of erythema, and unlikely if it transferred to PIH afterwards, inshallah it won't. So we like to make what's called feathering around the area we are treating. So it will be a unitone and eliminate the demarcation line that all our patients are complaining about the days after in the downtime. So let's go to the other interesting part, which is you have here more tools. That you have the size of the microthermal zone is determined by 3 spacers. One of them is 800 micrometer, the other is 300, and the last one is 120. And you'll find another one which is 120 small. It's similar, but with a small area, so you can treat the minimal or the very delicate area you want to treat. So the 120, the microthermal zones are very tiny, so it's very focused, so you can reach a deeper area to treat. The 300 is intermediate, and we are using most of the time, unless we need a drug delivery or a keloid, where there's a big space, so we need to penetrate much deeper. And the 800, because it's a very wide thermal zone, so the energy is not concentrated here, so it's very, very, very superficial. So if you want to go a deeper lesion, please don't use this. And remember that this one will make your fractional laser near the ablative one, especially if you do not decrease the dots per size. So here, this is what fractional laser make. We first make the kill zone, which is the microthermal dot we are doing with the ablative laser. And around there is the area of coagulation. And here is the key for our treatment. If you are aiming to rejuvenate the skin, in any treatment we are going to discuss, we need to widen this area of coagulation. But if we are in need for just drug delivery or in special indications we're going to talk about, we do not need all that coagulation zone. We do not need to rejuvenate. So here you need to minimize your beam size type. So let's talk about the dots density. Please, this is very crucial, because increasing your skin density or dots density will lead to more downtime. It's very risky in dark skin type. So if you have a dark skin type and you need to make the treatment and you assess well, you're taking care of complication, the patient promised you he'll stay away from the sun, please minimize the number of dots. Because when you are increasing the density size, you are going more for ablative way. Here is simply your interface when you're using the device. From here, you can choose the mode of spray we discussed before, hazard, random, whatever. And here is the shape of your scanner. Mainly, we are using the square. You can use the triangle in the nose area. Maybe a square for some scars. And here, where you can determine your density, your energy, which is separated from here, from the watt, and it's very cool because it increased the range of indications we can use. And you can use whether moving or auto. Auto, when you press, it will deliver like hair removal continuously the pulses. Moving, it will spray all over when you are moving, so take care of this moving mode. And finally, when you are confident with the parameters, you start to save it for your next patients. This is the key of our presentation. If you want to take a photo, this is our guide for using this device. We want to make drug delivery, we're treating PIH, we're treating keloids. We do not need that much pulse duration. So we will increase the depth by stacking and decrease the pulse duration. But when we are talking about rejuvenation, we are talking about acne scars, we are talking about stretch marks. So you will need to widen your pulse duration, more zone of coagulation, more rejuvenation, and collagen remodeling. So every patient coming to our clinic is aiming for rejuvenation. And as a dermatologist, our skin is not just, we are not aiming for just skin, we're aiming for our skin, for nails, for mucous membrane, for hair. 4 things we are already, as a dermatologist, are dealing with. So surprisingly, I'm gonna start with the nail rejuvenation. Actually, you have 2 methods or more to make a nail rejuvenation using fractional laser. First of all, in treating some dermatological disease, like we know that onychomycosis, we have a very poor circulation, topical treatment doesn't go well. So it's better to make a drug delivery method. So from the previous slide, we do not need much pulse duration, we just need depth, and then apply topical drug. We all know that the micro channels we are making with CO2 for skin, it lasts for 48 hours, right? But nail, it's different. There's papers talking about like 30 days the micro channels are open. So applying the topical antifungals afterwards would be beneficial. So we are forming small holes in the nail. The rejuvenation, there's also a very debate about it. Type. Nail peeling. Peeling or nail peeling is popular right now. It can be done by chemical and it can be done by laser, by exfoliation, breaking the bonds in keratin. So this will be beneficial in mechanical aggression, like manicure, chemical aggression with acetone, or pathological conditions like onychomycosis, lichen planus, and psoriasis. So this is a case of psoriasis, nail psoriasis, isolated nail psoriasis. So we have tried to make a fractional laser for this case and apply topical steroid. But we have discovered that this result was achieved only 1 month after. And this is not logic. We know that psoriasis, if we are treating, the skin, our nail have to be healthy, growing from the nail matrix. So it will grow up by one until it reaches. But sudden result in 1 month, this is not logic. And that's what we searched for and found that nail peeling will cause shedding of the pitting in the nail psoriasis. So it improved dramatically in 1 or 2 sessions in a very short period of time. But here we are treating a pathological condition. So it's ongoing unless we are treating with systemic drugs or the patient is compliant to the topical steroids you're using. So what about follow-up? Follow-up after 4 months, we started to see that the activity started to grow again, and this is also logic. So we agreed with the patient, if we want to improve your quality of life, you come every 4 to 5 months, make single session, it will cause nail peeling, you will feel confident, you won't be feel shy anymore, and then please be strict to your home treatment with a medical, systemic, topical or systemic, to be cured or to be controlled. So we have to be honest with our patient that he must continue in his medical treatment, because when my patient saw this result, he discontinued all the treatment he's taking. I improved, but this is the long-term follow-up. Our next case was this case, a traumatic nail for 9 years. There's no improvement by any mean. So here, we didn't do that transepidermal drug delivery. We do a rejuvenation. So back to the key slide, we want to increase the pulse duration, increase coagulation, stimulate the nail matrix, and this was the result. Unfortunately, the patient after 4 months told me I don't feel any difference. Really, and that's why documentation is very important. And when I showed her, she was veiled, and when I showed her the result, she made like this. So please document your cases and don't be like me. Okay, lips. Here we cannot promise much more for lips rejuvenation, but it's important because it improves the collagen production, improve the texture, improve lip coloring. So sometimes patients need a quick rejuvenation for the lips. They don't want fillers, skin boosters, or whatever. So this can be easy, cheap method to make a quick rejuvenation, but we don't do it on a new filler patient because she will blame you on any deformity or any rapid absorption to the fillers afterwards. So, periorbital. And here in periorbital, we are not surgeons. there's a lot of pathology that surgeons correct during making the blepharoplasty. So our aim here is to improve the texture of the skin tone, and the fine wrinkles. And when you put your device in the right track, you'll get the marvelous results. But if you are aiming for a non-surgical massive blepharoplasty, that won't what you get. So it only, as I told you, we cannot remove fat herniation, muscle hypertrophy, whatever. We're just seeking improving fine lines and skin tone. So our enemy here was fractional laser, sun. Many patients want to do procedures, but nowadays we don't have the luxury of staying at home even 2 to 3 hours a day to stay like 1 week at home. So here we can treat patients who doesn't have the luxury to stay at home with a rejuvenation session with minimal or no downtime. So by fractional laser, this is very hard because when we increase pulse duration for rejuvenation, it will take moderate downtime according to your settings, Yani. So here we have the Edge 1 pulse. The Edge 1 pulse idea is to deliver a very high power at a very short pulse duration. So it will make some skin rejuvenation without downtime. It's a minimal downtime, maybe just even fine erythema, which will fade 2 to 3 hours later. And the patient can continue these treatments frequently, but on the expenses that she doesn't want aggressive treatment. So this can be useful. Okay, during process of aging, many colleagues talked about before, so I'll pass it quickly. We have the elastic fiber becoming thinner. We have fragmentation and decrease in collagen. And skin tightening by fractional laser has 2 ways. It's by new collagenesis, which will take time, and immediate shrinking of collagen, which will give you the fast results you see in the first month of treatment. That trendy Instagram and TikToks video where you see the skin is shrinking upon delivering the microthermal zones, that happened because of the immediate shrinking of collagen, and the patient will see very fast results, and you can promise her that after 3 to 6 months, she can results will be better again. So here we have finished our rejuvenation handpiece of fractional laser, and still the most important rejuvenation tool, the surgical one. So you will have 2 handpieces, one F100 and F50. F100 actually is better for incision because it's very precise. So if you have a skin tag with a very narrow pedicle, you can do it with this one. Surgeons sometimes use it for cutting. And if you want to evaporate a wide lesion, it's better to use the F50 handpiece. So when you are treating eye, don't use continuous wave because it will be very traumatic and the collateral damage will be a lot. So you have to stick to the ultra pulse. So please, my first recommendation here, do not use any pulse in surgical mode except the ultra pulse in the eye area. And we see here improvement, alhamdulillah, without any scarring. Okay, this is very tricky. This is a case of pyogenic granuloma. All people here, dermatological, who are seeing pyogenic granuloma know that once you start to do the case, a gush of bleeding is present. So you have to start with the continuous mode and on a high power to minimize the amount of bleeding. And then when you are reaching the base and you're stopping the bleeding, you start using the ultra pulse, so you'll not result in deep scarring. This result was only after 1 week, so afterwards I didn't take the picture, but the healing was perfect. يعني oral mucosa actually يعني healing تاعها is very good يعني. So my recommendation here, start first with a continuous mode, reach the base, then do the ultra pulse. And here, seborrheic keratosis. It's very nice to work with seborrheic keratosis because patients see you like a magician, but we all know as a dermatologist it's a stuck on lesion. So no need for aggressive parameters. It's very superficial. So first of all, when you have a huge mass like this, you will start with continuous mode, 1 by 1, remove the necrotic debris by a wet saline gauge. And then at the end, start with the ultra pulse, so you will not leave any deformity left on the skin. Okay. dermal nevus, a very wide base. So we'll use the F50 handpiece as I told you, and also start with a continuous pulse on a low power, and then when you reach the base, try to make it with the ultra pulse to have a better cosmetic outcome. Same case here, this patient will be arranged for Q-switch laser afterwards. Same here, start with the continuous mode and then go to the ultra pulse. When you have a case like this, female case this is only one session, we arranged for another sessions. I don't think that the patient will improve when you do cheek filler lifting, polylactic acid, whatever, any type of biostimulation or fillers you're gonna do. The focal point will be the dermatosis papulosa nigra the patient has, if she's a female, or the skin tags. So first of all, you have to clear the house using your laser. When the patient face is clear, whatever you will do for her, it will have a great outcome. Because when she look at the mirror, she will see first a clear face, and then the lifted face, the contoured face, the jawline, whatever she wants to be. This is immediately after pyogenic granuloma. Actually, there's a video, but it will not work. And now, let's jump to the combined laser treatment. Here, we are going to talk about the fractional handpiece again to combine our treatment. This is a case of vitiligo, stable vitiligo. Do not work with fractional laser or any dermabrasion in an active vitiligo because you may experience copnerization. So you will, when you know the history of this case, you'll know how hard it is because when we do a dermoscope, we found a leukotrachea. In our dermatological here, we know that there is a leukotrachea. The only case here, if it's wide, that is surgery, whatever punch grafting or melanocyte suspension. So we found here some perifollicular pigments still present. So there is a little bit of hope. The patient is very young. She doesn't want to go for surgery. So we started use fractional laser irritation stimulation of melanocytes and then applying topical 5-FU solution. And this result was after 3 sessions and still continuing with excimer light. When you have already a perifollicular, you don't need surgery. Just fewer number of sessions, you will achieve the result, and you will notice the excimer probe marking here. So it's a very good tool in combination for a vitiligo patient and has a very good outcome. Here you don't need you need moderate pulse duration, but you need more the parameters for setting the transepidermal drug delivery. So. As Monsieur Amin is also distributor of Photona here, this photo is from Photona. Actually, it's a key player in tattoo removal that you combined your fractional laser or fractional erbium with Q-switched laser for many reasons. The frosting you have on the top has similar beneath your skin, which will act as insulator for subsequent applications. You will not reach the same power and same effect as your first session. Eliminate the excess heat and decrease the incidence of post-hypopigmentation when we're doing Q-switched laser for dark skin color. And act as a melanin shuttle when using the right depth. So here, we do not need rejuvenation. Remember the slide you all saw before? We need just the drug delivery method to make the holes, and then immediately you can start your Q-switched laser. And here I show you this only case for tattoo because it's difficult because this patient has a dark skin color. So he is more liable with high settings to post-hypopigmentation. And this after 4 cases or 3 sessions, we find the skin almost 90% normal without any hypopigmentation seen. So combining 2 lasers may be shocking in the first start, but when you see the result, when you know the science behind it, you'll find it very important to combine it. I always combine fractional laser with Q-switched laser. And this is what you see. I was here doing the R20 method. First of all, I do a fractional laser and then Q-switched laser. When you know R20 method is you are doing your Q-switched laser 20 minutes and for start and then rest 20 minutes until the frosting eliminates and then do it again up to 4 times. And here we do not need for that 20 minutes because as you see the frosting is not too much as we are using combining fractional laser. Yeah. Thank you. Any question regarding first presentation?
Thank you for your presentation. It's very clear, very rich, and very precise. Thank you. I don't know if someone have a question for Doctor.